As the COVID-19 pandemic unfolded, I don't think anyone could have really anticipated the full impact it would have on our way of working and those we support. Initially, there was a period of uncertainty where we adapted to new ways of working, a steep learning curve of COVID risk assessments, PPE instructions, working from home, how to use new software to conduct remote meetings, and significant changes to the availability of resources and the methods used to request them. For those of us who are parents, there was also a need to support our children through this uncertainty and other constant stream of updates from schools to absorb. In the early stages, for a large part, those I support in the community hunkered down. I'm not sure whether this was as a result of expecting the lockdown to be a brief hardship, of not wanting to place further pressure on frontline services, or of plain old fear. I expect it was a combination of these factors. The hospitals soon began to reflect the reality of COVID-19. NHS colleagues from community teams were redeployed to hospital wards, families were prevented from visiting their loved ones, and many colleagues were laid low with COVID. Sadly, but inevitably, we began to hear news of patients who had succumbed to COVID-19. Then the stark reality really started to impact us. Amongst all of this sadness, however, there were rays of light. People showing their appreciation for the NHS and key workers, a recognition of the sacrifice many had made which they could not have foreseen when they chose their career path. Communities began to mobilise to support each other. Local area coordinators became a conduit for much of this community spirit and coordinated huge numbers of volunteers who responded selflessly to support others. Rainbows in windows, clapping on Thursdays, the long and glorious summer, Sir Captain Tom Moore, God rest his soul, socially distanced VE Day, street parties, etc. These were where the hope lay. Despite the lockdown, social distancing measures, hand washing and face masks, COVID-19 persisted, and it became apparent that this was not a brief hardship. Many individuals living in the community saw reductions to domiciliary care services in order to prioritise those most in need. Carers of these individuals began reporting significant strain. Other services on which carers relied, such as respite and day service, were put on hold. Many individuals with dementia, for whom routine was a vitally important aspect of their lives, allowing them to maintain their independence in the community, had this routine snatched away by lockdown and found themselves unable to cope. Hospitals were desperate to discharge patients to free up beds and prevent transmission of COVID. Care homes were themselves adapting to completely new ways of working and managing outbreaks of COVID-19 amongst their residents and staff. There was nowhere to turn where COVID-19 did not influence decision-making for professionals, individuals and their families. By the end of the second lockdown, change had become a part of daily life. We stopped expecting a return to normal and began to accept the new normal. However, there was some hope as schools reopened that some aspects of normal life might return. As autumn approached, with it came the NHS COVID-19 app and hopes for a vaccine. But there was also a sense of trepidation at coping with traditional winter pressures alongside the additional challenges of COVID-19. Lockdown had brought community transmission rates down, but other countries began to report news of a second surge of cases, feared to be more deadly than the first. There were regular changes in guidance, stay home, stay local, etc., to adapt to, alongside changes to hospitals and care home visiting rules. Families were grateful for the opportunity to visit loved ones, if even from behind a screen. COVID-19 became a part of business as usual, as seasonal events such as Halloween and Bonfire Night were celebrated very differently, and many began to look towards Christmas as a time when we might be able to spend time with loved ones. Sadly, that hope was not to be realised for many, as the predicted surge of cases became a reality, and a further lockdown was announced as we approached the Christmas period. People's plans were put on hold yet again, and although for me this seemed sensible, given that vaccine rollout was imminent, there was a sense that the positive spirit which had been evident in the summer months was beginning to dwindle. Little wonder. It was cold and dark, and the light at the end of the tunnel seemed unreachable. Again we were faced with rising transmission rates. The NHS groaned under the pressure, and care home transmission again became a real issue, frustrating hospital discharges and again reigniting a sense of fear in families. Now it is March, and revisiting the events of the last year seems unreal. I could not have anticipated how much my team and I would need to adapt, nor would I have wanted to. I feel privileged to have received both vaccine doses and to have been part of a team that has continued to provide support to the most vulnerable in our communities. Of course, there have been many challenges and much sadness, and we are not out of the woods yet. But there has also been a demonstration of compassion and care for our fellow man. If anything is to be gained from this time, I hope it is a sense of community support and spirit, and a renewed appreciation for what is given by those who work on the front line.